Hello and welcome to the Caring Support Podcast, your healthcare podcast that cares, and the show where we dive deep into the world of healthcare and explore the incredible stories and experiences of the unsung heroes who work tirelessly to keep us healthy. I'm your host, Cali, and I couldn't be more excited to embark on this journey with all of you today because we have the amazing rock star, Dr. Madhumati Singh, healthcare administrator at Youthdale Treatment Centre. Welcome. We're very excited to have you here today.
Thanks, Kaylee. I'm excited as well.
Yeah, so why don't we just jump in and you can tell us a little bit about yourself. What got you to who you are today?
Okay, so as you know, I'm a healthcare administrator, and that is my passion. I've been in this field for more than a decade now, and I have worked at tertiary care hospitals, health centers, and now this is the newest challenge for me. That is the mental health domain, which I'm still exploring and learning new things every day. But yes, I'm a healthcare administrator. That is who I am.
Sounds like a very interesting avenue to go after in healthcare. Can you maybe walk us through your educational journey that led you to becoming a healthcare administrator? What motivated you to pursue this?
Yes, so this is a very twisted journey, I would say, because I did not start as a healthcare administrator. After my school, I went to study dental surgery, and I was a very happy dental surgeon. I practiced for some time, and then I realized, maybe I can take up bigger challenges. I can make a difference to in a way the healthcare is being delivered across. And that is when I thought I should explore healthcare administration as a field and pursue that as a career. And that was the changing point. And yeah, since then, so I studied full-time healthcare administration from India. My entire education has been in India. I worked there, and then here I am.
That's amazing. So you did all of your education in India. Did you do any over here? Because you immigrated from India how many years ago?
It's been exactly 1 year.
Wow. Well, congratulations. It's been a year. That's
Thank you.
awesome. How did your background and experiences influence your educational journey and your career path as a healthcare administrator in Canada? What was there something that really was like, this is exactly why I need to do this?
Yes. So, after my studies, I started as a junior medical coordinator. So, where I was involved in clinical operations and quality work, like doing audit, even handling patient complaints, managing the doctors, scheduling the OPDs, and so on and so forth. So, everything under the hat of medical administration. After which, I have been under different roles, like starting a hospital from a project phase to operational phase, and so it's like it has given me an exposure of multiple hands you need in when you are handling medical administration and quality. So I would say when I migrated here, I realized that this is the profile which I really want to be in, continue. And if we say quality in healthcare, it is the same everywhere. We want the best for our patients, or our clients, whoever we are serving. We want to provide the best of care. And it's no different wherever in the world you are. You want to follow the quality standards, the accreditation standards, which are meant for the healthcare bodies. And there you are. And then there are ministry guidelines. So yes, if you are following all of that and ensuring you're compliant, you're good to go everywhere.
Have there been some key changes or trends that you've seen in the healthcare industry that have influenced your approach as a healthcare administrator?
So I would say a lot has changed, especially after COVID. We have gone into virtual consultations, and there are patients are wanting to go for, even though we are somewhat out of COVID, there are people who would still like to go, have teleconsultation. So as healthcare administrators, it's our duty to prepare for what is coming. And then there is a digital transformation happening in healthcare. So we are behind our electronic health records. There is a lot happening in healthcare. So yes.
So how many roles have you had as a healthcare administrator so far?
So like I said, I started as a junior medical administrator, and that was my first role at a tertiary care hospital back home in India. And then after learning the basics of administration, I moved on to my second role, which was starting off a mother and child care hospital which was like from project space to starting of the clinical department, the outpatient and the inpatient. That was a learning experience in itself. After which, the third assignment, where I went to another tertiary care hospital where I was handling clinical operations and quality. That was during COVID times, and that was, I would say, the most challenging times because nobody was prepared for COVID. That was new for everyone. So, and to have to sustain, give quality care and to accommodate patients during that time was a challenging role, but it was a learning experience. I would say the most enriched learning experience till date.
So part of what we do with our podcast is we like to try and give some advice or some insights for people that are looking to get into your career field. So with the experiences that you have had, do you have any advice or tips or tricks that you would like to give to aspiring healthcare administrators that are maybe in school right now or just coming out of school or getting ready to graduate in the next year?
Okay, so yes, I would say starting a career, or first of all, deciding a path is not easy. So once you have made up your mind that you know this is your field, this is what you want to do, and if at all you have come from a different place, so I would just combine everything together and speak for everyone. The first thing is to embrace cultural competence. If you are an outsider, you've come here, you come with that mindset that okay, I have come to a new place. It is my duty to embrace the culture, and be it the work culture or the diversity which is there in that place, which is actually, the beauty of this place. There's so many diverse cultures here, and you get to know everybody, but you have to be open to accepting it. That is what I would say. Don't come with any backlog and just come and embrace things. Next, I would say, start building your professional network. That matters a lot. Even when you are a student or you are starting as a fresher, that you will realize, how important it is once you actually start working, and then it is your internal network which most of the time gives you the information you need or helps you with the projects you are doing. Even when you are doing a research, you want people to participate. So yes, that is a very important part for everyone who is starting new, build a professional network. At last, once you feel you have finished your studies, but then you should keep upgrading yourself always. That, it's learning never stops. So seek educational opportunities, go for certifications which you think will be helpful for you in your growth or in your, in exploring new avenues. And at last, understand the healthcare system. Each country is different. Forget country, each organization is different. The policies, the values they follow, it's all different. Just try to understand the system wherever you are and be persistent. That's what I would say at last. Be persistent, things will work out.
That is amazing advice. I think some of that can actually translate into multiple different areas, not even just healthcare administration. So thank you. So we're going to switch over a little bit into talking a little bit more about what you do at Youthdale. So can you tell us what drew you to work at Youthdale?
Cali, Youthdale is a leading Toronto-based nonprofit organization, and they cater to children and young adults and their families who are struggling with complex mental health needs. And, it's a very vital population. And to recognize that they need mental health support in this age, especially the challenges which they go through in school, in society, especially after COVID, when they have been inside for such a long time. It's such a vital population. They are growing. There is a lot of changes. So to cater to that population has its own challenges and opportunities, of course. It's something which the society needs at this time. And at Youthdale, we provide level 4 and level 5 support to clients. There are a lot of programs like secure treatment program, inpatient programs, day treatment. So I think this is a very broad spectrum.
So you had mentioned that there are unique challenges and opportunities associated with what you do with Youthdale, and that Youthdale focuses on providing mental health services to children and youth. Could you maybe discuss some of those challenges that are associated with administering healthcare in this demographic and how it would be different than, say, working with just straight like adult programs?
Right. we were talking about challenges and opportunities in the field of mental health, when especially talking about children and young adults. So, as I said, in Youthdale, we provide treatment and we cater to children. Mostly the age group which we cater to in different programs altogether is around 10 to 24, like acute support, transitional age unit, transitional psychiatry units, and then we have inpatient house too. Each program has a specified age group as well, but overall, this is the spectrum. And this is the period, which is very critical to their development, maybe it physical, emotional, cognitive changes. And to address mental health in this population, it's a very sensitive and complex population, I would say. And when a child moves from his or her house to live in treatment house, there's a lot of emotions involved within the family as well. To take the family's emotions, to work closely with them, and to work with the client together itself it's challenge, but then it's also helpful because we bring the families together. It's an interdisciplinary work. We bring the other specialists together and form a treatment plan which can work very well with the client. They're going to be with us for almost 5 to 6 months. So what is going to work for them, and what other options should we explore? This is challenging, but we see, like, we have seen successful results, so it is worth the challenge. And the most challenging part with the highest high equity clients is to prepare them for this transition when they're coming here, going back to their home, going back to the school, facing the society, and creating that balance between home life, society, and school. Is to prepare them for that. That is challenging, and also it's nice to see them being prepared for that.
So something that you had mentioned kind of back at the beginning of the podcast was how people are still so much into like virtual appointments, and the exchange of information is very digital now.
Mhm.
And there's obviously been, an increasingly digital aspect to pretty much everything healthcare related, which can be a little bit scary when it comes to like privacy and security. So as a healthcare administrator, are there specific strategies that you employ to ensure the privacy and security of patient information?
So, like I said, the digital healthcare industry is going through a digital transformation, and it's of utmost importance to recognize what are the challenges and potential risks associated with it. We bring in a new technology, but then we also have to be prepared for the potential threats it's going to bring along. When clients and their families share their confidential data with us, they have sort of trust and faith that we're going to protect that data and use it for their benefit, and use it to design the treatment plan which they need. So it is a big responsibility, and we are trying to give it that importance which it deserves, and taking all the measures to protect all the sensitive information. So we have our policies around data security and privacy, which all the staff members from across the programs, they have to review while they're onboarding. They are supposed to sign the confidentiality agreement, and then we also have a dedicated privacy officer who oversees these matters related to data security. And the pattern of work has changed a lot. Like I said, patients want remote appointments, same ways. And sometimes employees are also working in hybrid models. So to access the patient's data when they are not in the office, at home, it's altogether a different, IT related issue. And we're trying to put all that together and make the staff undergo constant training so they know what not to do when they are outside the office and what data to access. And then we also have access control. Like if I'm working in a particular program, I will have access to only those clients who are there. So I think that these are some of the controls we are trying to build to avoid any data leakage. And yes, constant training, data privacy measures through information technology. Yes. So all of it, we are trying our best.
It sounds like you're doing amazing.
Thank you.
Could you share maybe a success story or an impactful moment in your career as the healthcare administrator at Youthdale where you've maybe made a significant difference in the lives of the children and the youth that you've worked with?
So yes, I would say the most significant change, we won't realize it's a significant change unless we are able to measure it. So at Youthdale, what we are trying to do is implement an evidence-informed and measurement-based care. So we know how our clients are performing. We are able to measure it and design the treatment plan or modify the treatment plan accordingly. So to see that to see the results, to visualize, to have that qualitative data being matched with quantitative data, and to get the results. Like, we know we are doing our best, but how do we see the results? I say, okay, this client came with depression, but at what level he or she was, what was the score at that time, what is it now at the time of discharge, to be able to analyze that and see what results we are giving. It's not just about giving results, it's also a morale boost for the staff. Okay, we are doing good work, when we are able to project that, we are able to showcase that the modalities we are using are actually making a difference to the clients. So yeah, I think that is where we have done, I can proudly say we have done great work.
Yeah, it sounds like you definitely have done some amazing work there.
Thank you.
Yeah. So we are coming to the end of our episode today. And my last question for you, I am going to give you the floor because I would love to know if there's anything else that you would like to tell us about today.
I would like to praise you guys because you're doing an amazing work bringing people involved in healthcare delivery together. Most of the time people have this notion that healthcare means only doctors, only nurses. No doubt they are wonderful and they form a major, they are like the brains and the backbones, but there are so many other vital elements which need to be put together to form an efficient healthcare system. I would say, even like, there are paramedics, there are front office staff, there are administrators, there is HR, there's marketing in the organization. Everybody has a very important role to play in the healthcare industry. Without that, it won't strive. So you guys, I see you guys, focusing on each and every element, bringing them together and giving them the due coverage they deserve. It's amazing.
Thank you. Thank you very much. Yeah, it's in our hearts across the company to just be this positive change in the healthcare industry. And we just want to be a part of making connections that are going to last. And it's a huge passion for the entire company. And I know, normally we have another host with me. Normally James is here, and I'm sure he could tell you, like, he could talk your ear off about it, and he'd be just totally excited about what you just said. So on behalf of Caring Support, thank you so much. I appreciate you pointing out, that we're doing good stuff, because that's what we're here to do. So
Thank you, Kaylee. I'm so happy to be here. It
well,
was a pleasure.
that's yeah. Well, we're very thankful to have you here today, and that does bring us to the end of our episode. And I want to extend my deepest gratitude to you. For being our incredible guest today and for sharing your insights and experiences with us. I would also like to remind anyone that's listening to subscribe to the Caring Support podcast so that you can catch all of our episodes with the incredible Dr. Madhumati Singh and everybody else that we have on our podcast. So together, let's continue to learn, grow, and be inspired by the incredible healthcare workers who shape our world. Thank you again for joining us today. And until next time, don't forget to do some self-care, show the healthcare workers in your life some love, and keep having those really important conversations. Take care, everyone.